Hello everyone. Today we've got Max again. Max, who looks like a kitten but is a full-grown glutton who only cares about food. And Max has left us. All right. Today we're going to talk about engagement, which clearly Max is not with this class. So engagement is one of the 7 skills needed in order to practice with the Just Practice framework. So we've already covered the 5 concepts that underline the Just Practice framework. Now we're going to start in these skills or action areas that actually allow us to engage in the Just Practice framework. So the first one is engagement. So engagement happens when social workers enter helping relationships. They enter with their own biases and prejudices. It is these biases and prejudices that can, and often do, affect how they listen to the problems of their service users and ultimately how they proceed to address them. So our own history and positionality impacts how we listen to others. So engagement is really a balance of preparation and openness. So you have to be ready to actively listen. So don't go in there and start thinking, oh, what's the next thing I'm going to say? We all do that as new social workers. We're so worried about what we're going to say. We stop listening to what the clients are actually saying. So we need to be open to hear what they're saying and to hear their perspective and their story. It's a mutual process and it requires a commitment to be actively engaged. You have to avoid imposing your own biases, as we mentioned, upon what you're hearing from the other person. So don't impose your interpretation on their explanation or their story until you have all the facts and until you hear their interpretation. And always remember that engagement is taking place within the context of power differentiation. In general, you as a social worker are going to have more power than your client. So even though engagement is the heart of social work and relationship is the soul of social work, we still need to actively engage in empathy, genuineness, and unconditional positive regard in order to recognize and account for this very big disparity in power that is present, especially in cases where we're working with an organization that has a history of institutional discrimination against the client base. So power is very much in this process of engagement. It's from the very beginning, from how we label and what language we use to refer to clients, be it patients in the medical field or participants in research, right? Service user. The language that we use labels the clients and imposes certain restrictions on them, right? It recognizes their positionality as somebody who is there to receive services, which sometimes also means that we neglect to view them as an equal partner in the decision-making process. Instead, we rely on our scheme of professionalism and think we know best and impose our whiteness or heteronormativity or ableism on them. So we got to challenge this history and recognize and honor these insistent daily struggles in order to actually connect with others and engage in positive engagement. And we always have to remember that this engagement takes place within a cultural political context, which not only has to consider the concept of culture, it also has to consider another story. So we need to open ourselves up to recognizing that we come from a specific culture, and every time we meet with a client, we're now being introduced to a new culture. Not everybody practices their cultures the same way, right? So we always have to be very open and very much practice cultural humility, to recognize that we can't know everything about every culture. So that's the sort of drawback to cultural competence, right? It assumes that you can be competent in dealing with other cultures, which you basically cannot. You can't know everything about other cultures. So that's why we move towards cultural humility and recognizing um, that you can't know everything, but what you can do is ask and acknowledge the client's response and their perspective on culture and how they engage with culture. We also need to recognize that engagement happens within communities. Communities are those buffers, supports, and constraints that can help us. However, what constitutes community differs from individual to individual, right? It might be those physically proximal to you, or your community might be entirely online because within your physical environment, there's nobody who is able to understand your positionality. LGBTQ youth, for instance, tend to find very strong support in the communities that are online as opposed to in person, particularly in rural areas. When we're talking about the organizational context of practice, we need to expand our organizational awareness and the distinctions of us as the professionals and them as the clients need to be challenged. So we need to understand how this power is manifested in us versus them and move towards a more participatory relationship where we basically share our power in order to empower the client or recipient or participant, whatever language your organization uses. And this is all backed by the need to work within a framework of human rights, right? I know it's challenging to talk about human rights when we're in a country that doesn't recognize them on an international level and doesn't ratify or sign most international human rights conventions, but we still need to do that within our everyday practice. This sort of grassroots movement and bringing in human rights within social work practice can eventually push state and federal governments to take human rights more seriously at the federal level. So consider what human rights your organization or program seeks to protect. What human rights violations have service users possibly experienced? If you work with refugees or immigrants, torture and political crimes are very frequent, so a trauma-informed approach is very appropriate in those um, scenarios. And you also might want to consider how critical consciousness of human rights can shape your approach to engagement. So by recognizing people as having human rights, how would that change how you approach them? Will you approach them as, your equals in the helping profession, or will you approach them as the expert who knows what's best for them? There's several skills that can help you be successful engaging with clients. The first that the textbook mentions is empathy and anticipatory empathy. So empathy is, trying to put yourself in the shoes of another and understand their situation. Anticipatory empathy is what we do to prepare ourselves beforehand. So as we are preparing to meet with the client and reviewing their case notes, we become ready to um, hear that client's story and to acknowledge it, right? And that involves a lot of the listening, the attentive listening, the radical listening that the textbook talks about, but it also involves the observation, the noticing, and the bearing witness of that story. So for a lot of clients, they just want to be heard. They don't immediately want us to offer solutions. First, they want to be know that they are heard, and then you can start talking and discussing solutions together. But you've got to listen to the entire story first. And you also have to be body conscious. So this means attending not only to what they say, but what they do with their body language. And you have to recognize, and I don't think the textbook does a good enough job explaining this, but there's a lot of cultural differences in what active listening looks like. So, for instance, in some cultures, it's considered very rude to engage in direct eye contact, with somebody else who is perceived to be in a superior social situation. So it's viewed as a sign of respect to avoid eye contact with that person. That doesn't mean that, from uh, our American cultural perspective, that they are not listening to you just because they're avoiding your gaze. They are listening, they're just being respectful. You also have to notice people's body language. In some cases, when you introduce yourself, somebody might not want to shake your hand, and you have to understand why that might be. And this is why, and something I learned the hard way, I always wait for the client to indicate to me whether or not they want to shake hands when we meet. Because the first time I met, for instance, with a couple who had just immigrated from Syria. They were refugees, and we were discussing their children's school performance. I went to shake the hand first of the wife and then of the husband, and when I reached out towards the husband, he actually stepped back. And it wasn't until much later that I realized that he was actually a Muslim man, and it is against their religion for him to touch a woman who is not a family member. So you will screw up. Um, there's no way around it. To err is human, right? But the important thing is to always learn from this and change your behavior in the future. Let's look now at an example of a population that's difficult to engage with um, and has been called resistant. So a lot of the times we use that label resistant as a negative to say, oh, these people don't want to change. But really, we need to recognize that resistance is actually a coping mechanism to a history of human rights violations and oppressions. What we're going to look at today as our case study is the increased incarceration of women within the United States and some of the reasons for that, and discuss how engagement with this population is going to be particularly difficult given the role that social work has played in getting so many of these women behind bars. Social workers have been directly responsible for the implementation of some of the policies that are now incarcerating women at much higher rates than men, including the failure to protect legislation. So failure to protect is what predominantly women are charged with when they fail to protect their children from what they should have recognized is a threat to them. Most commonly, this is applied to victims of domestic violence when they did not protect their children from the abuser. So even though the abuser is the one who is committing physical violence against both the mother and the children, the mother still gets charged with failing to protect the children, even though she was not directly responsible for the physical violence. And your readings for this week will go over the implications of this policy in more detail. Let's look now at some of the ways that we've tried to push back against these policies and challenge the issues against the issues that have brought so much women behind bars in the past 40 years. So one of the things that has started within Michigan is the Michigan Women's Clemency Project, which looks to challenge the sentences of some of these women who were unfairly charged with very long sentences for the crimes that others committed. And through a series of films and activism, they brought awareness to this topic and highlighted the particular vulnerability of battered women and the women themselves, by giving them voice through these documentaries, they were able to gain clemency from several governors for more than 13 women. And I've given you a list of some of the documentaries they've produced here, and I encourage you to watch any one of them. So the reason that we have so many women in prison right now is that between 1977 and 2010, the number of women in state and federal prisons grew by more than 800. Most of these were incarcerated for nonviolent crimes. So the same drug policies that are sending Black men to prison are also responsible for sending women to prison. So right now we're looking at about 200,000 women in jail with another million on probation. And you can see here the huge jump in the number of incarcerated women within state and local jails in the 1990s, um, with the increased use of mandatory minimums sentencing and what that resulted in for women. However, we can't talk about incarceration without also discussing the racial disparity that's happening. So you won't be surprised to learn that Black women, Indigenous women, and people of color, women of color, are much more likely to be incarcerated than white women. For instance, American Indian and Alaskan Native women are being incarcerated at almost 4 times the rate of white women. And Black women are being incarcerated at roughly 3 times the rate of white women. Who are these women that are being incarcerated? Most of them enter the criminal justice system with a very long history of emotional, physical, and sexual abuse that started when they were children and continued into their adulthood. About 85 to 90% of women who are currently incarcerated have a history of domestic or sexual abuse. And including other risk factors are substance abuse, mental illness, and as I mentioned, spousal abuse, with some 80% of women prisoners currently suffering from substance addiction. The problem also is that these women are mothers in most cases. More than 75% of women in prison are mothers, many of whom are sole caregivers. Pregnant women who are incarcerated are often denied prenatal care, and physical restraints are commonly used during delivery. And post-delivery, the child is taken away from them and frequently placed in care. Here we can see that this has a significant impact on their children. This is the comparison between African American and white children in having a family member who is in the criminal justice system. You can see that African American children are more than twice as likely to have a family member who is in prison than white children. And unfortunately, this graph ends at 1990, but in the 2000s, as the prison population exploded, the gap between white children and African American children grew even more. There's also disparities between genders in prison. So there's fewer alternatives to prison for women than men, and there's fewer resources for women in prison than there is for men in prison, just because the population is smaller. There's also disparity in how women are treated by the criminal justice system. And 40 to 80% of women who are convicted of murder, was found that they actually acted in self-defense and had no prior criminal history. In Oakland County here in Michigan, domestic violence victims had actual higher conviction rates and longer sentences than anybody else charged with homicide, including those with prior records, and the highest conviction rate was for Black women. Of the minority of women who are incarcerated for violent crimes, as I mentioned, most are survivors of domestic violence, but they're actually prosecuted under the very laws that are supposed to protect them from violence. An example is Marissa Alexander. She was a domestic violence survivor and a mother, and she was sentenced 20 years in prison for firing a warning shot at her husband, a man with a known history of violence against both her and other women. So she didn't actually kill him or injure him. She only shot a warning shot near him because she feared for her life, and yet she was sentenced to 20 years in prison. In New York State, 67% of women sent to prison for killing someone close to them had been abused by that person. Similarly, in 93% of the cases in California, women had killed their significant others because they'd been abused. And in 60% of those cases, those women reported that they were trying to protect themselves or their children. Women also face barriers upon release from prison, particularly in re-entering society and providing for themselves and their children. Women of color who are disproportionately poor are very restricted from government assistance programs. For instance, you cannot be on welfare or receive subsidized housing if you have been convicted of certain crimes. So, how are women supposed to provide for themselves and their children? Many states also impose statutory bans on people with certain convictions from working in certain industries, and these are predominantly women-led industries like nursing, childcare, and home health care, which poor women and women of color are forced to rely on for their income. So they're pushed to working in under the table sort of arrangements where they're subjected to poor pay and discriminatory um, employment practices, basically. So you can understand from this very brief synopsis of the situation why so many women of color uh, might be very hesitant to engage with social workers and might come to social workers or their schools, their children's schools, from a place of rage. They've been treated so unfairly by the criminal justice system and by the social system that rage is a very understandable reaction to all these institutional discriminations that they've been forced to face. It's an open wound that's festering. They have been uh, put in a position where they can't afford to care for themselves or their children by these systems. And now, social workers are coming forward and saying, hey, I'm an expert in this, I can help you. No, you have to prove that you can help them, and you have to justify your role within this relationship in order to engage with these women. And you very much have to listen to their story, as we talked about active listening, to let them give their perspective on everything that's happened to them and bear witness to their story in order to begin to build that relationship so you can get a place where you can hear about what they need. Don't assume that you know what they need, let them tell you, and then work together to achieve that.